Hello. Hello, good evening everyone. Am I audible to all of you? Please give me a thumbs up if I'm audible. Let me just increase the volume a little. Hello everyone. Okay, am I audible? All right. Okay. So today we're going to start a new this thing on numericals in PSM. Okay, this is the first part of it. Let me just give me 1 second. I'll just Yes, all right. So I can see all of you here joining. Thank you so much. Okay, so this is the first part of numericals in PSM. Today we'll be trying to just have a look at some of the MCQs of epidemiology and screening. It'll just be a 30 to 35 minute sessions and we have 10 MCQs. So for all those who do not know me, just a little heads up, I'm Dr. Neha, your mentor and guide for PSM on Unacademy platform. And at Unacademy, we have launched a FMG batch course also, which is running. All those who want to subscribe can subscribe to it. You can use my code Dr. Neha 10 and get a 10% off. Also, these are your educators who will be teaching you for the FMG batch course. So with just one subscription, you will get an access to all these 19 educators who are going to teach you live on the platform. Also, we are running an Operation NEET PG batch course. Again, here you can, these are your educators who are teaching you, and we are, conducting all the live classes or live quizzes, everything. So you can subscribe to Unacademy. Just use my code Dr. Neha 10 and again get a 10% off. Also, an FMG batch course. Under the FMG batch course, I am starting a PSM course for FMG students that is starting on 18th of October and it will go on till 22nd of November. So it will be every day for 2 hours, 10 p.m. to 12 p.m. at night. So you can leave your preparation on me, your PSM preparation on me. Again, you can use code Dr. Neha 10 to get a 10% off. So just download the Unacademy app, put in NEET PG, and you can subscribe to the various courses. Also, we've introduced an iconic subscription at Unacademy where you'll get both Unacademy and Prep Ladder together at discounted rates. So all those who are planning to buy it for 1 year, 2 year can definitely avail this opportunity. Again, if you use my code Dr. Neha 10, you'll get a 10% off. All right. Hello, everybody. I can see quite a number of you now. So are you all ready to try with the numericals for the day? All right. Okay. So my first question to all of you is, this is a simple one. It's not exactly a numerical, but you just have to use your brains a little over here. All right. This is from the chapter of screening. The question goes, a new method of measuring hemoglobin levels has been developed. 10 successive readings of a single sample are as follows: 9.4, 10.4, 9.6, so on and so forth. But the hemoglobin measured by standard calorimetry was 10.2. Therefore, the given method has option 1, low validity and low reliability, low validity, higher reliability, high validity, low reliability, or high validity, high reliability. Just before we go to the session of exactly solving the MCQs, let me see how many of you get this correct. Very good, Soumya, Praful, everybody. I can see your answers. Surjeet, Swati. Good. All of you are writing the correct answer. So now look over here. If you remember, I have taught you what is the meaning of validity. Validity simply means how close your calculated value is to the expected to the expected value. So here the hemoglobin measured by a diagnostic calorimetry test is 10.2, and your values are all the time closer to this 10.2. So therefore my test definitely has a high validity. But what is reliability? It simply means repeatability, reproducibility. So every time we are doing the test, we are getting different values. Therefore it has low reliability. Am I clear, everybody? So it was a simple one. You just have to remember the definition of validity. Validity also is called as accuracy, and repeatability or reliability is nothing but, what is the other term for it? It is also called as precision or reproducibility. Okay, so this was just a warm up question kind of thing where you had to just use your brains a little. Now let's go forward to the exact numericals that come. All right, so here your first question is, in a population of 5,000, number of new cases of TB is 500. Old cases in the same population are 150. What is the prevalence of TB? So I want all of you to try it without using a paper and pen. Is it 9%? Is it 12%? Is it 13%? Or is it 18%? So I want all of you to try this question. Yes, is it 9%? Is it 12%? Is it 13% or is it 18%? So I can see your answers. Start putting your answers, everybody. So you have to, this is the very first question of PSM where we get questions on incidence and prevalence. All right, so this is one of the most commonly asked topics, incidence and prevalence. All right, so I can see good, I can see most of you marking the answer is correct. All right, so this is a very basic question. Prevalence क्या होता है? What is prevalence of any disease? It is number of new cases plus the number of old cases, all right, divided by the population at risk. All right, so multiplied by, what is the multiplier? Good, everybody, the multiplier is 100. So although we say it as a prevalence rate, what it is actually, a bonus question for all of you, is prevalence a rate, ratio or proportion? Put in the comment section below, everybody, is prevalence a rate, ratio or proportion? Let me see how many of you get it correct. So since the multiplier is 100 over here, prevalence becomes a, very good, it becomes a proportion. Very good, everybody. All right, now numerator is part of denominator, but my multiplier is 100, so it becomes a proportion. Now how many new cases are here? 500. Plus how many old cases? 150. Plus what is the population at risk? 5,000 into 100. तो ये कितना हो जाता है? If you calculate is 650 by now, yes, 650 divided by 5,000 into 100. So that will come around 13%. Is it clear? So this was an easy and a good question, which is a very basic one. If you get question on incidence, it will just be, what is incidence of a disease, guys? Incidence of a disease is equal to new cases divided by population at risk, all right, multiplied by 1000. Okay, therefore it is a rate because multiplier is 1000. All right, I hope everybody has understood. Let's go to the next question for the day. All right, this is a very good question. Okay, a couple has 4 children, all unvaccinated for measles. All right, a child got measles on 5th of August 2015. 2 other children developed measles by 15th August 2015. What is the secondary attack rate? Now, one of the most commonly asked numericals from the chapter of epidemiology is secondary attack rate. All right. So let me see how many of you are able to mark this question correctly. Start putting your answers. Take your time. There is no rush. Aram se karo. The very first thing that all of you should do when you're trying to solve numericals is, please visualize the formula in your mind. What is the formula? Very good. I can see answers coming now. Good, Praful, Vibhu, everybody, Raj, Ravi, Shivani. Good, not bad, very nice. All right. So let me just tell you how you should calculate it. Okay. This is one of the, like I told you, one of the most common topics. Now, what is the formula for secondary attack rate? Okay, it is very simple. It is the number of secondary cases, All right, number of secondary cases that develop on exposure to one incubation period, all right, to the total number of susceptibles. Is it all right? This is the formula. What is the multiplier in case of secondary attack rate? Here also the multiplier, please remember, is 100. All right. Now, one golden point that all of you have to remember for secondary attack rate, that primary case has to be deducted from numerator and denominator. Okay, मैं यहाँ पे लिख देती हूँ. Primary case has to be deducted. All right, primary case has to be deducted from what? From numerator. All right, and denominator. So now tell me, everybody in the comment section, how many were your secondary cases that developed measles? यहाँ पे लिखा हुआ है, a child got measles on 5th August. So this became a primary case. All right. He was the first child to develop measles. Very good. Then 2 other children developed measles. So these 2 other children became your secondary cases. Now, how many are susceptibles? Look over here. There were 4 children who were unvaccinated. All of them were susceptibles. But you have to subtract the primary case. तो आप यहाँ पे क्या करोगे? -1 multiplied by 100. Is it clear? So this becomes 2 divided by 3 into 100. So how much does it come to? 66%. Is it clear, everybody? Very good. Raj, Ravi, Andy, everybody. All right. Please remember the golden point when we talk about secondary attack rate is that you have to remove the primary case from both the numerator and the denominator. So here the first case that developed became my primary case, and the number of secondary cases were 2 that developed following the incubation period to that primary case, and susceptibles were 4 minus 1. Is it all right? Give me a thumbs up. Can we go to the next question? Everybody has got this? Understood? Can we go to the next question? That's a pretty easy one. Let's go to the next question now. All right. Now, the next question goes, a party was attended by 110 people, out of which 40 didn't eat fruit salad. From the rest who ate fruit salad, 55 developed food poisoning. What is the attack rate? All right. Okay. So let us go to this next question. Good. Everybody has understood. I can see Bhaveen, Surjit, Aib. Great. Very nice. Now try solving this, guys. A party was attended by 110 people, out of which 40 didn't eat fruit salad. All right, from the rest who ate fruit salad, 55 developed food poisoning. What is the attack rate? Is it 46? Is it 56? Is it 78? Is it 50? All right, Sheikh, what I'm going to do is, let's focus on this question right now. Before I end my session, I will definitely come back to secondary attack rate and explain you once again. Is it all right, Netik? All right. You asked me, so I will explain you once again. All right. Okay. Good. So I see a lot of answers coming in, and most of you are marking 78. That's not bad. Good. So now, guys, attack rate क्या होता है? Anybody, can you tell me the synonym of attack rate? What is the, if I ask you, what is the synonym of attack rate? Attack rate क्या होता है? Is, oh, like, what is it? Is it what is some other name? It is nothing but, anybody put in the comment section, it is nothing but incidence rate only. All right. Attack rate is a term that we used most commonly during, it's one of the most commonly used terms during epidemics. All right. So यहाँ पे attack rate कितना हो जाएगा? The formula is very good. Prasad, you've written it correct. It's incidence. Attack rate is nothing but number of new cases of a disease, all right, divided by the total population which is at risk into 100. Okay? So how many new cases of a disease developed? 55 developed food poisoning. So they are new cases. What is the total population at risk? 110 minus 40. Why did we subtract 40? Because they did not eat fruit salad, so they were not exposed to it. Also, attack rate mein, what are you going to use your formula is? Tell me, everybody. Good, everybody. So this multiplier will become as 1000. Okay, so how much will it come to? 55 upon 70. All right, you can multiply it, it will come to 78%. Is it clear, everybody? Okay, so it's like an incidence rate only, and you just have to know that so many developed food poisoning, how many were my incident cases, new cases, divided upon total population at risk. All right, let us go to the next question now. All right, the next question is, everybody, in a study of 200 smokers, 600 and 600 non-smokers were followed up for a period of 10 years to find out the incidence of hypertension. Out of 200 smokers, 60 developed hypertension as compared to 600 non-smokers, of which 30 developed hypertension. Risk ratio of this study is, come on, do it everyone. Is it 3? Is it 30? Is it 1/3? Is it 6? Let me see how many of you are able to mark this correctly. Now, what is the other term for risk ratio? Anybody? What is the other term for risk ratio? It is a measure of strength of association in. Start putting your answers. Risk ratio ke liye another term is, let me see how many of you are able to mark it correctly. We'll give you some time. Good, Bhavin has put his answer as B, I guess. Okay, let's wait for a few more answers. Somebody is putting it as 6. All right, let's wait for a few answers. Very good, Raj Ravi. Risk ratio is nothing but relative risk only. This is a measure of strength of association in which study design? In a cohort study design. All right. Okay, so I can see most of you are getting you're trying to put in answers. A bit of confusion between option C and D. Very good, Jayansh. Good. Namrata, good. All right. Okay. Now, see, risk ratio means relative risk. Okay, we have to calculate the relative risk. So, whenever you get a question of risk ratio or relative risk, you have to first think about, I've told you, your 2/2 table and think about its formula. Now, what is relative risk? It is nothing but, or risk ratio, incidence among exposed divided by incidence among non-exposed. ठीक है? Now think about your 2/2 table. So यहाँ पे क्या है? Hypertension is my outcome. So it comes here. Yes, no. All right, everybody paying attention. Smoking is yes, no. Vasavi, what you have written, AD upon BC, that is the formula for odds ratio or cross product ratio, which we use in a case control study. Abhi, I'll be giving you a question for that also. Risk ratio is basically relative risk. Okay, so now read over here. In a study of 200 smokers, so how many are my smokers? If I put over here total, my smokers are 200 and 600 non-smokers. So my non-smokers are 600. Okay, to find out incidence of hypertension. Out of these 200 smokers, 60 developed hypertension. So how many developed hypertension? 60. As compared to 600 non-smokers, of which how many developed hypertension? 30. Okay, so this is A, this is B, this is C, this is D. How much will your B become if you see? This will become 140, and how much will your D become? 570. Now tell me, what is the incidence among exposed? So kitne exposed hai total? Look over here everybody, incidence among exposed. Total exposed is 200, okay? So 200, and how many out of them developed hypertension? 60. So 60 upon 200. And non-exposed kitne hai? Everybody tell me how many are non-exposed? 600. And how many out of this 600 developed hypertension? 30. Is it clear? So how much this becomes? 60 upon 200 into 600 by 30. Alright, so how much will this come to? 6. Alright, so basically relative risk क्या होता है? Incidence among exposed, which is incidence among exposed divided by incidence among non-exposed. So A upon A plus B divided by what? Divided by, everybody, are you understanding this? Okay, non-exposed में कितना हो जाएगा? C upon C plus D. So now, how are you going to interpret it? That all those who smoked at 6 times higher chance of developing hypertension than non-smokers. ठीक है? Whenever you get a question of relative risk or odds ratio, you have to know the definition, you have to know the formula, and you have to know the interpretation. Am I clear, everybody? Give me a thumbs up if everybody has understood this. This is a very important and a most commonly asked questions. ठीक है? I want your thumbs up so that we can proceed to the next question for the day. Everyone clear? All right. So the first thing that you will do is what it is asking. Think about its formula. Think about making the 2x2 table, and then we're going to proceed ahead. Okay. Next question coming up on the board for all of you. Now, yes, very good, Surjeet, Bhaveen, everybody. Good. Now start with the next question. The incidence of carcinoma cervix in women with multiple sexual partners is 5 times the incidence seen in those with a single partner. Based on this, what is the attributable risk? So, is it 20%? Is it 40%? Is it 50%? It is 80%. Now, relax and think about the steps that I've told you. The first thing, attributable risk. What it is, what is its formula? Think in your mind. Think in your mind. What is attributable risk? Definition socho and think about its formula and then start doing it. Very good. I can see answers coming in. Good, Soumya, Vasavi, PS, Kishore, everybody, Srijana, very good. All right. So the very first thing, like I told you, you have to think kya hota hai attributable risk. What is attributable risk? So this is a measure of strength of association only. In a which study? Everybody in the comment section. It is a measure of strength of association in which study design, guys? In, again, a cohort study. What is the formula for attributable risk? It is incidence among exposed minus incidence among non-exposed divided by incidence among exposed. Okay? Clear, everyone? Now let us see what is the thing that they want over here, that the incidence of carcinoma cervix in women with multiple sexual partners is 5 times the incidence seen in those with a single partner. So suppose the incidence in people who have single partner, all right, we take it as X, all right. So how much is the incidence among women who have multiple partners? How much will that become, students? That will be, it's 5 times more. So it is 5x. Now all you have to do, students, is put it over here. Attributable risk. Incidence among exposed kitna hai? They have multiple partners. So it is 5x minus single partner x divided by 5x. What is the multiplier in attributable risk? 100. So ये कितना हो जाएगा? 4x by 5x into 100. So how much will this go? Become x cancel. This will become 80%. Am I clear, everybody? This is one of the most loved questions that are asked in your entrance examinations. All right, very good. So most of you got it correct. Good. So this is also seen in a attributable risk is another important question that comes from the chapter of epidemiology. Okay? So just think about writing the formula and how you're going to reach to the answer. Let's go to the next question for the day. A very easy one. Association between coronary artery disease and smoking was found to be as follows. What is given in this table? The odds ratio can be estimated as. So now I don't want anybody to use paper and pen. Just do it manually. What is odds ratio? It is a measure of strength of association in which study design, students? It's a measure of strength of association in which study designs? Let me see how many of you are able to tell me. Odds ratio is a measure of strength of association in. Very good. It's a measure of strength of association in case control study design. All right, Soumya, मैं यहाँ पे बना देती हूँ again. Okay, this is CAD. This is no CAD. All right, this is 30, 20, 20, 30. Here it is smokers and here non-smokers. Is it all right? Can you now do it? Good, very good. So odds ratio is a measure of strength of association in a case control study design. This is A, this is B, this is C, and this is D. odds ratio, the formula is very simple. AD upon BC. Very good. Now is the value visible? I've written it on the top. Raj Ravi, have a look on the top. Okay, now start putting your answers. Very good. Amardeep has already answered. Good. It's a pretty decent question. इससे ज़्यादा simple नहीं आता exam में. Alright. So that is 30 into AD. So that is 30 divided by BC. 20 into 20. Alright, everybody. Very good. So how much will it come to, guys? All right, good. So very good. So this will become, you can just calculate it, and it's going to come as 2 point, how much? 2.25. Is it all right, everybody? Okay. Okay, good, everyone. All right. Can we go to the next question? This was an easy one. All right. Now, the next question I have again given you of odds ratio, but I want all of you to calculate odds ratio now. Okay. In a study, there were 35 cases of lung carcinoma and 82 controls were there. On taking history, 33 cases had positive history of smoking. All right, and 55 individuals among controls had positive history of smoking. What is odds ratio? Now, in the previous question, I gave you a simple one. I gave you the values. You just had to do AD upon BC. Now, मैं आपको क्या दे रही हूँ? I am asking you to draw a 2x2 table. Think about a 2x2 table and calculate odds ratio. So I'm waiting for your answers. Let's see how many of you are able to get it correct. See, if you attend these numerical sessions, okay, it will help you in practicing. And with practice only, you will be able to do it in examinations without pens and paper, because numericals in PSM are going to definitely turn up in your entrance examinations. There is no escape. So, जैसे बोलते हैं ना, practice makes a man perfect. All we have to do is practice numericals so that it's on your tips and you can do an examination. All right, very good. So, I can see a few answers coming up already. Start giving your answers. Amardeep has written D. Somebody by the tagline of few dollars has written D. Waiting for a few more answers, then I will tell you how to go about this question. All right. Okay, so when we do odds ratio, again the thing is you have to go for cases, all right, and you have to go for control. All right, okay. After cases and control, यहाँ पे क्या लिखोगे आप? Again the same thing, smoking, yes, no. So now see, 35 cases of lung carcinoma. So cases ke below, if you see, very good, Santamani has given an answer. Now look over here. Let's try to solve it. Okay. Everybody knows the formula for odds ratio. What it is? It is AD upon BC. ठीक है, अब यहाँ पे देखो, on taking his 35 cases of lung cancer, so this is 35, and 82 controls, so this is 82. On taking history, 33 cases had positive history of smoking, so obviously this becomes your 33, all right, and 55 individuals among controls had positive history of smoking. So how many are your controls? 82, जिसमें 55 had positive history of smoking. So this becomes your 55. Calculate, this is A, this is B, this is C, this is D. So how much will your C become? 35 minus 3, so that is 2. How much will your D become? 82 minus 55, so that is 27. Is it clear? So what will be your odds ratio now? AD upon BC. So that is 33 into 27 divided by 2 into 55. तो ये कितना हो जाएगा guys? If you solve it, 891,110, something will come to 8.1. So the nearest to that is 8. Am I clear, everybody? A thumbs up needed now to let me know that you've understood the concept of odds ratio. The very first thing, as it is, go step by step. Formula, okay? After that, 2x2 table, then put the values in the formula. Very good, Soumya. Yes. Mostly it's going to come out to be 8. Okay? Good, everybody. Good, Netik. Let's go to the next question for the day, everyone. All right. Good. Great. All right, now don't think it is, you don't need to calculate over here. I'm giving you a hint. You have to calculate in this subject to come to actually be able to derive the answer. ठीक है? आराम से पढ़ो question. What is it? In a prospective study comprising 10,000 subjects, 6,000 subjects were put on beta carotene. All right, and 4,000 were not. Okay. 3 out of first 6,000 developed lung cancer and 2 out of second 4,000 developed lung cancer. What is the interpretation? Option A, beta carotene is protective in lung cancer. Option B, beta carotene is not protective in lung cancer. Option C, the study design is not sufficient to draw any meaningful calculations, or beta carotene is carcinogenic. This was a NEET PG question. So why are we saying, okay, Abid, why did you say your answer is actually calculating? See, the first thing, it's a prospective study. So this hints that it's a cohort study. Okay, because it's a prospective study. Now, if you see over here, again, I am going to draw something. Lung cancer, yes, no. ठीक है, बीटा कैरोटीन यहाँ पे ले लो, yes, no. So this total जो population है is how much, guys? Everybody, total population is 10,000 over here. ठीक है? Now 6,000 subjects were put on beta carotene. That means how many had beta carotene? यहाँ पे total आ जाएगा. Beta carotene, yes, is 6,000. All right, and 4,000 were not. So this is your 4,000. Now 3 out of the first 6,000 developed lung cancer. So 3 developed lung cancer and 2 out of the second 4,000 developed lung cancer. All right. So 2 also out of those who were not put developed lung cancer. Now everybody in a cohort study, what do you actually calculate? Relative risk. Okay? That is incidence among exposed by incidence among non-exposed. So what is the incidence among exposed, guys? Everybody tell me. It's the same thing. कितने exposed है? A upon A plus B. So exposed कितने हैं? 6,000. So 6,000 और उसमें से how many develop lung cancer? 3. Divided by incidence among non-exposed. So how many are non-exposed, guys? Here it's 4,000, and how many developed lung cancer out of that? 2. Okay, so now when you calculate relative risk, it will become 3 upon 6,000 by 2 upon 4,000. Is it clear? So this is 3 upon 6,000 into 4,000 by 2. So how much will this come to? Everybody tell me. ये कितने, how much will it come to? It's going to come to 1. Is it clear? Very good, Abid. Now, what is the interpretation in case of 1? Can anybody tell me what is the interpretation? Now, relative risk can take up values in a study more than 1. It could also be equal to 1, or it could be less than 1. When it is more than 1, it indicates a positive association. Am I clear, guys? When it is equal to 1, it indicates no association. And when it is less than 1, it indicates negative association, or it is a protective factor. Very good, Vibha. Now, since in our question, our answer came out relative risk to be 1, that means there is no association. What does that mean? If there is no association, it means that whether you take beta carotene or you do not take beta carotene, all right, it will have no effect on lung cancer. Okay? So the first option, beta carotene is protective, no, because relative risk is not less than 1. Beta carotene is not protective, yes, because my relative risk is equal to 1, which indicates no association. Very good, Soumya, Netik, everybody. Now, study design is not sufficient. No, it is sufficient. And definitely we have nothing to do with beta carotene being carcinogenic, because our RR is equal to 1. So like I said, whether you take carotene or you do not take beta carotene, it will have no effect on lung cancer. Am I clear, everybody? So you just cannot go marking the answer. You had to think that why has it given us so many numbers over here? All right, because it wants you to calculate RR. Why RR? Because it's a cohort study, and accordingly interpret it and then put your answers. Am I clear, guys? All right, good, Faizan. Very good. All right, now let us come to one more numerical. We have 10 numericals a day. All right, good. Now I want all of you to read this. A study was done to assess the risk factor for breast cancer in 100 females from urban cities for which image is shown below. How many studies reflect actual risk factors that may be ascertained correctly from statistical analysis of the research? Now, suppose this is for risk factor 1, this is risk factor 2, this is risk factor 3, this is risk factor 4 and 5. Now, you have to just tell me that how many risk factors actually have a statistically significant association. So start putting your answers. Is it 2, 3, 4 or 5? I'm waiting for your answers. All right, I can see some of you pulling in. All right, tell me, what is this image? It could be an image based session also. What is this image called as? Anybody, what is this image? If I asked you in the question right now that what is this image? So what are you going to tell me? What is this image called as? Everybody quickly put in the comment section. All right, I can see a few answers coming in. Kishore, Soumya, Vasavi, Raji. Good. So this is nothing but a forest plot, or you can also call it as a blobogram. All right. And this is used to provide an effective pool size, or what we call it as effect pool size, or effect this thing in a meta-analysis. Okay. So now over here, when you have to see that how many risk factors actually show a statistically significant association, to look at odds ratio. Okay, now again, odds ratio could be more than 1, could be equal to 1, could be less than 1. So if it is equal to 1, it will mean no association, or if it includes 1. So look at the first study of Smith et al. 1991. The odds ratio का range क्या है? 0.5 से 2.6. So it includes 1. All right. So no association. Look at the second study, 1 to 3.4, Johns et al. Again, it has included 1, so no association. Look at the third study, Smith et al. 1999. Again, 0.9 to 3.2, it has included 1. So no association. Now look at the fourth study, 1.9 to 2.7. So 1 is not included. That means NG et al. में जो भी risk factor है is statistically significant. Look at the fifth study. All right, again the range does not include 1. So this is statistically significant. Am I clear, everyone? Give me a thumbs up. Therefore, the answer to this is 2. All right, now one step ahead if we go, they can ask you what is the effect size, okay, from this. All right, this was asked in AIIMS paper. They can ask you what is the effect size. So the effect size is given by a summary measure which is indicated by the diamond. Okay, so here the effect size is 2.2 with an interval of 1.9 to 2.4. Again, it does not include 1 and it is statistically significant. So you've learned two things. You've learned how to interpret a forest plot, and how to, the second question that they can ask you, risk factors statistically significant, and they can also ask you what is the overall effect size or the estimate. Am I clear, everybody? Good, Soumya, very good. Am I clear? So these were the 10 numericals. Everybody has understood. I can see most of you have given the right answers. Okay, good, everyone. Now there was one person who wanted to study about that secondary attack rate question. So let me just quickly go back to that question and show you about secondary attack rate. All right. So here secondary attack rate क्या होता है? Number of secondary cases out of the total number of susceptibles into 100. So here a couple has 4 children, all are unvaccinated. A child got measles on 5th August. So one who gets measles on 5th August becomes the primary case. Okay. 2 other children develop measles by 15th August. So these 2 are the secondary cases. Now how many are susceptible here? They have 4 children, all unvaccinated. So 4 were susceptible. Subtract the primary case from this, -1. Therefore 2 by 3 into 100, which is 66%. Okay. So I'm sure, I hope this session has helped all of you. Okay. It was a session on numericals. I will come again on Wednesday. Okay. Meanwhile, all of you do like, comment, and subscribe to Unacademy. I will be having these numerical based sessions on Mondays and Wednesdays at 6:30. All right, okay. Thank you so much. Okay, Janita, you want to listen to the last question. Dekho, if we go to the last question, let me quickly tell Janita about the last question since she wants to know about it. Okay, Janita, this is a forest plot which tells us about effect pool size or effect estimate which is given in a meta-analysis. Okay? Now, any value which includes 1, okay, over here odds ratio may, if the interval includes 1, that means that particular study or risk factor is not statistically significant. So यहाँ पे 0.5 से 2.6 है. So since it includes 1, it's not statistically significant. Is it clear, Janita? But look at NG et al. And Chu et al. Study here, 1 is not included. All right, therefore these are statistically significant. I hope I could help you understand this question. So again, I will see you all on Wednesday at 6:30 p.m. With another set of numericals on screening, particularly on Wednesday. So every Monday, Wednesday, we'll keep having certain numericals. Meanwhile, please like, comment, and subscribe to Unacademy, and they have beautiful courses running on Unacademy. You can subscribe to them. You can get in access to all live educators. And now I'm going to sign off. Thank you so much for being patient and listening to me. I hope these numericals help you. If anybody has any other numerical that you're not able to understand, you can message me, you can ping me on my Unacademy profile also, so that I can include those questions in this marathon session. Thank you so much, everyone. I'll see you again on Wednesday at 6:30 p.m. If you want to subscribe to any course on Unacademy, use code Dr. Neha to get a 10% off. Thank you so much.